Collins, thank you so much for joining me on UpFront. According to a recent poll, in the United States, only 27% of parents of 5 to 11-year-olds said that they were eager to get a vaccine right away for their child. Why do you think people are more hesitant to get the vaccine for children than they are for themselves?
Well, it's interesting. If you go back and look what happened when vaccines were first made available to adults back in January of 2021, it was pretty similar. It was about a third of people said, yeah, sign me up. Let me roll up my sleeve. And there were a lot of people like, let me wait and see and think about this. So maybe the numbers aren't that different. These are kids, after all, and I'm a parent and a grandparent, and when it's about your children, you want to be really sure you know what the facts are and you've figured out the benefits and the risks. So let's see what happens over the course of the coming weeks and months. I'm not too surprised that the initial response is a bit muted, but when people do look at the data, they will see, because it's very easily accessible now, that these kids in the trial, there were more than 3,000 of them, aged 5 to 11, got a 91% protection against infection from this Pfizer dose, which was 1/3 of the adult dose, and had no really unexpected side effects other than the sore arms that we adults have also experienced. So it looks to any kind of rational assessment to be a really good opportunity to protect your child from this disease, which can make children very sick, even though generally they do better than adults. That's not always the case.
The risk of children getting a severe case of COVID is 0.05%. Why are COVID vaccines necessary for children?
Well, I'm not sure when you give that percentage that really conveys what most people are worried about. Is my kid at risk? I mean, go to any pediatric ICU in the country and you will see kids there with COVID, some of whom are on respirators as a result. And we have seen 145 children die. These are kids between the age of 5 and 11 of COVID-19. Many of them without any predisposing medical condition that would have made you think they were vulnerable. So it may be uncommon, but it's certainly not unheard of for kids to get really sick. And that doesn't even count those who get COVID, seem to have recovered, but then have the long-term effects we call long COVID, which can include fatigue and brain fog that makes it hard for kids to perform well in school. So trying to balance this out, the risk of the disease versus some uncertain and so far not well identified potential risks of the vaccine, it sure looks like the vaccine is a better bet.
Okay. In the United States, COVID-19 infection rates are higher among Black, Indigenous, and other people of color. So is vaccine hesitancy among those very same populations for a variety of reasons, including a history of being subjected to medical testing without consent. How should this be addressed?
Well, it's a really important point. In the U.S., we don't have a good history of health equity amongst racial groups. And so there has been a lot of effort put into trying to spread really valid information to those groups that are most likely to be skeptical. By the way, it's looking like that is kind of working. If you say, let's look at those who are fully immunized in the United States, the levels now for whites and Blacks and Latinos are almost the same at about 70%. So it got off to a slow start, but I think there's been a pretty good catching up as the information got shared. I hope that will happen also with children. But again, we have a lot of work to do there to overcome what is quite understandable in terms of distrust based upon past experiences that people from racial and ethnic minorities have had with the healthcare system, which didn't necessarily seem to be meeting their needs. We have work to do here.
And that work that needs to be done, part of it is the information sharing that you talked about. The other part might be acknowledging historical wrongdoing. Do you think the medical community and the government has done an adequate job and a sufficient job addressing those histories?
Well, people often bring up the really wrenching story of Tuskegee, where African-American males who had syphilis were observed and not offered treatment, even when treatment was known to be successful. And that never should have happened. That was totally unethical. President Clinton made a formal apology for that back in about 1998. Another example that's raised is the HeLa cells that are used from lots of different laboratories to study various aspects of medicine, derived without her consent from Henrietta Lacks, a young African-American woman in 1952. We at NIH have worked really hard with the Lacks family to try to make sure we're doing that part right now, and they've become some of our best allies in trying to see how we could right those wrongs, but also make it clear that we do want medical research to be able to go forward and to benefit everybody.
Another source of distrust is Big Pharma. A 2020 survey showed that 32% of the American public viewed profit as the main reason that pharmaceutical companies are producing COVID-19 vaccines. Can we trust that the process wasn't rushed just for profit motives?
Well, I can tell you, having been in the middle of the process of developing these vaccines, that it was not rushed in a way that cut any corners. This was a full partnership between the federal government, academic institutions, and companies, and we wanted to be sure everybody was held accountable. So I understand that concern.
What does that mean? What does it mean to be held accountable?
That you basically have designed and conducted trials in the most rigorous way, that the results of those trials are being evaluated by people who don't work for the company and don't work for the government, and they decide whether the vaccine was actually safe and effective, and that's what was done.
Why are companies able to make money off of research that was publicly funded?
Well, this is a complicated and challenging issue. We did at one point try to figure out ways that the government would have reach-through abilities for any kind of research that was funded by the government. And then if a company made some money, they would have to basically feed back funds. And that is done all the time with intellectual property claims. But if you go too far with that, companies stop being interested in actually building upon the government-funded research. You know, our ecosystem in the U.S.
Would that have been the case this time, though, in the middle of a global pandemic? Would that have been the case that companies would have lost interest or pulled back if those types of circumstances had been produced?
It might have changed their approach a bit. I think you're right, though. In a global pandemic, everybody wants to help. And I know it's tempting to demonize pharmaceutical companies, but we need them. Nobody else is going to actually put vaccines into vials or make pills. And if we want to see success against a terrible pandemic, we need them as partners. We just have to hold them accountable. We have to trust and verify that this is being done in a fashion that is scientifically rigorous.
Speaking of holding them accountable, one of the issues is that companies like Moderna are saying they won't enforce their patents, but at the same time, they're still not sharing the recipe, right? They're not giving the know-how of how to make the vaccine. So others can't make a generic version of it. It's one thing to distribute the vaccine. It's another thing to create the context and the conditions for countries to generate the vaccine safely and on a widespread case. What do you make of it?
Well, it's a really tough and complicated issue, but an important one. Yeah, in an ideal world, I would want to see Moderna be more generous with their ability, not only to say, okay, you can basically use the information in our patent, but we'll help you. We'll help you set up a factory. Now, they've made a commitment to do that in Africa, but the timetable looks like it may be quite long. Other companies, I think, have been more forthcoming. Johnson & Johnson, in particular, now working in South Africa to try to do more of this. Pfizer certainly talking about that. So I think it's appropriate for all of these companies to have some public pressure to say, hey, you guys, if you're making a lot of money here, you've got a responsibility to the world to be more generous.
So you talked about generosity, which still is sort of individual choice. You talked about public pressure. But what about government intervention? What about states actually making some sort of demand? Do you think government's role is to intervene in this way?
I think certainly governments ought to be able to apply a pretty strong amount of pressure, even calling this a moral situation and calling on companies to behave in an ethical and moral and altruistic way. I'm not sure in most instances, because I'm not a lawyer, what other levers they have to pull to demand it or require it.
I mean, part of why I ask that is because Moderna and the U.S. are currently in a spat right now over the patent rights over the coronavirus vaccine. which was jointly developed with the National Institutes of Health. Moderna received a huge amount of funding from the office within the Department of Health and Human Services, which now holds the vaccine recipe. So in this case, the U.S. government has the ability to share it with other countries. Why aren't they?
Well, as you referred to, there does seem to be a significant spat where Moderna is now claiming that they have the patent on this COVID-19 vaccine and have not included U.S. government co-inventors, which we at NIH think was an unfortunate step that they have taken and have been quite public in stating that. So we'll have to see how that plays out. If the government were also in a position of being a co-inventor on that patent, then the government would have more levers to pull to make sure that it was made available to others.
This seems like something that could have been resolved at the drafting stage of this agreement. The United States government drafted the agreement and the terms with Moderna. Do you think it was a mistake not to make open sharing of vaccine technology one of the conditions, one of the terms?
That sort of goes back to how things were worked out in the process of Operation Warp Speed. And I think there was a great deal of attention there to trying to get vaccines manufactured and tested as quickly as possible. I was not engaged in the details of those contracts, so I'm not sure I can answer your question.
My question is, should it have been? I understand you don't know the details of what happened, but was it a mistake not to have the open sharing of vaccine technology as part of this?
It's a little hard to answer that in a simple way. What does open sharing mean? Just like we were talking about before, it's one thing to say we're going to share everything in our patent and our technology and our recipe. But what you really want companies to share is their expertise. They have the technical experience of how to actually build a factory and make that go. That's a harder thing to put into a contract, but in many ways, it may be the most important.
Doctor, before you go, what did we learn from COVID? How can we use the information that we've gotten, the experience we've gotten, to help protect us against future problems, future inequities when the next pandemic comes?
That's a great question, and some of us are spending a lot of our time on that right now. We could learn from this and should immediately be acting on that to identify ways to make our response even faster and more global should this happen again. And it probably will. This is not the last pandemic that we'll see. We have a reasonable idea of sort of the 20 most likely pathogens to cause the next pandemic. Why don't we start now to develop vaccines against those, at least carry them forward to the point where we'd be ready to run a clinical trial rather quickly if one of those actually emerged? Why don't we develop drug therapies, antivirals for those 20 most likely pathogens and move those along as well so that we would have that kind of treatment available, which we really haven't had for COVID-19 until fairly recently. All those are things we could do in preparation. It's going to cost money. It's going to mean that people are going to have to decide this is a priority and we can't slip back into complacency. But there are really important lessons here that we could act upon, and I think we must.
Dr. Francis Collins, thank you so much for joining me on UpFront.
Glad to be with you.